Claire, Doctors Without Borders is also on that list. How is this ban affecting your medical teams on the ground? I mean, how big a setback is it?
It's a massive setback. I mean, this threat to withhold the registration of Doctors Without Borders, but also other international organizations like NRC, is really a cynical attempt to even further restrict humanitarian services, both in the Gaza Strip and in the West Bank, at a time where the humanitarian situation in Gaza is nothing short of catastrophic. And really, right now, the situation is worsened by harsh winds and dropping temperature. So it is extremely cynical. And I think it's also important to state that it is in violation of Israel's international obligations under international humanitarian law, because granting access to humanitarian aid is not optional, it's not a luxury, it is mandatory under international humanitarian law. So very much like NRC, MSF, Doctors Without Borders, continues to work in Gaza, but we've not been able since the beginning of the year to bring in international supplies. We were able to continue to do that until the end of last year, but with numerous and almost systematic blockages or delays from the Israeli authorities. And we've also, since the beginning of the year, not been able to bring in new international stuff. So it is extremely concerning, because today Palestinians need more aid, not less aid.
You call this move by Israel a cynical move. The Israelis say they're doing this to prevent infiltration of these groups by Hamas. What is your response to that?
Well, what I can tell you is that, unfortunately, we're now under a defamation campaign from the Israeli authorities, which have accused organizations, including MSF, to hire members of armed groups. And it's very important to categorically refute these allegations made by the Israeli authorities, because we would never knowingly employ anyone involved in military activities. I think it's very easy to understand that it contradicts our core values and ethics, as well as humanitarian principles, but also it would put our patients, our staff, and our activities at risk. We're very concerned that these allegations are being made without any proof, and that they contribute to delegitimizing the critical work that are being done by humanitarian workers, again at a time where the needs are extremely high.
Claire, the World Health Organization warned that the health catastrophe in Gaza will last for generations. What are the main challenges that your doctors face right now?
Absolutely, and I think, building up on what has been said before, violence continues in Gaza very much on almost a daily basis, and it continues to kill and maim Palestinians. The population is really facing massive humanitarian needs and medical needs. What we see is that we continue to see a lot of people being injured, coming to our clinics. Either they've been recently injured or not, but come back for follow-up care. Burns patients as well come, and an increasing number of patients come because of infections or diseases linked to the dire and appalling living conditions. Very much, of course, linked to winter. We see an increase of respiratory diseases, but also gastric diseases and a lot of diarrhea. We also see malnutrition, continue to see malnourished children and pregnant and lactating mothers, and people coming because of the dire conditions. The health system has been nearly entirely destroyed after over 2 years of conflict. The overwhelming majority of hospitals and health centers have been damaged or destroyed, and the ones which remain and continue to provide care to patients provide so to a very high number of patients, and with not enough supplies because of the blockages that we were speaking about earlier. So it's really important that there is a scale up of humanitarian aid into the Gaza Strip, and therefore this announcement that registration will not be renewed to organizations that precisely do so, provide care to Palestinians, is a devastating blow, because it will leave hundreds of thousands of people without care. Just to give you an idea about what we do in Doctors Without Borders, in 2025 alone, we supported 1 in 5 hospital beds and 1 in 3 births. We basically carried out almost 800,000 outpatient consultations and managed over 100,000 trauma cases. We also did more than 10,000 deliveries and distributed over 700 million liters of water, and that's just for Doctors Without Borders. And we know that despite these critical activities, we're not doing nearly enough, and because of all the blockages put by the Israeli authorities. So it's really important to increase aid and not decrease it.